In this video, I will go over how we make a dental bridge on lower anterior teeth. I'm Rick Buck, and I've been a dentist for 17 years. This patient, as you can tell, isn't the best at keeping up on their oral hygiene, but she wanted to not use a partial denture on her front teeth anymore to replace her 4 front teeth. She also didn't want to go with implants to replace those teeth, which I would have preferred to do. So on this day, we're ready to take care of the patient, and after the patient is numb, we start by filing down the canines next to the space in the front teeth. We file these teeth down 2 millimeters around the circumference and off the top of the teeth. This will create a negative space that will be filled in by the final bridge. The bridge is going to attach to just these 2 teeth. Since normally there isn't that much pressure that goes on the front teeth, attaching a bridge to just these 2 strong canines is sufficient retention to hold in the final bridge. As we are filing the teeth down, it is important to note what I am doing. As I file down the teeth, I'm making the remaining tooth, or stump as a lot of people like to call it, so its perimeter converges at about a 5 to 10 degrees. Less than that, and the teeth won't have natural retention to hold in a bridge, and they'll likely loosen in time, even with a really good cement. If the perimeter of the stump is parallel or diverges, then you may not be able to slip on the bridge. Each stump just doesn't have to converge at 5 degrees all around the tooth. It has to converge at 5 to 10 degrees with the other tooth across the way that you're also filing down, so that they both converge with each other. Now, as I finish drilling, I make sure I have enough clearance between the bottom and top teeth. I also stop to make sure that the walls of the remaining tooth converge appropriately, like I said before. If you can see all the way down the stumps from top to bottom without any undercuts, then you will have a bridge that you know you can fit onto these teeth. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. Now, once I'm done with the majority of the drilling, I put something on the gums that stops bleeding, and it's called Viscostat. The gums have taken a little bit of a beating during this procedure because I make sure the margin, which is where the crown and the tooth meet, starts below the gum level, so it absolutely cannot be seen. Sometimes a lot of practitioners do this right at the gum level, and there are pros and cons. There will be less bleeding if you do it right at the gum level. Before this appointment, we took another impression of the patient's teeth and made this clear template that will help us make a temporary bridge. After the gums have stopped bleeding, the dentist will either take an impression, as I sometimes do here, or they will scan the teeth as I normally do. Here, I will show a 2-part impression where I use a hard, fast setting material to take a molding. Then after, I add a very detailed layer to that first impression that I took and snap that back into place. The lab will then make a stone model of the teeth and build a bridge made out of zirconia. In the meantime, while the lab's doing that, the patient will wear a temporary bridge that we make at the end of this appointment. So we fill the template with a fast setting acrylic, as you see here. When we put that impression that we took beforehand and we put it in the mouth, it will take a minute or 2, and then we remove it and we have the temporary bridge roughly made. We then just have to refine the temporary bridge so that it fits nicely, and what you see here is not the greatest, but it will get us by. If the patient wants a prettier temporary, we can't actually accommodate that. They just have to come in for an extra appointment beforehand, and then there's an extra cost. Otherwise, the temporary bridge is fashioned to their previous teeth. A few weeks later, we get the final bridge back, and then we remove the temporary bridge from the patient and we try the permanent bridge in the mouth, and we are observing for 5 things. First, we make sure the bridge contacts the other teeth next to it adequately so it doesn't get food caught in it. Second, we ensure the bridge sits down all the way and doesn't rock, or it will loosen in time and you'll have other issues. Third, we make sure where the tooth and bridge meet is flush, otherwise cavities can easily start in these areas. Fourth, we check the patient is biting evenly on the bridge. And fifth, we make sure the bridge looks good. Our patient loves it. You will notice that this bridge has some pink prosthetic gums added underneath the teeth. Otherwise, the teeth teeth would just look really long. This bridge met all of our parameters, but sometimes we make a few adjustments for it to pass. So then we just cement the bridge in place with a glass ionomer that we mix up. It will set after a few minutes, and then we just clean off the excess cement. This stuff is extremely strong and will hopefully hold the bridge in for the rest of the patient's life. The two things that people really don't like about these bridges are that you have to file down otherwise healthy teeth. Anytime you file a tooth down, it can also have problems down the road. Another thing is that it's difficult to clean underneath these bridges. Other than that, these bridges are actually a great option for replacing missing teeth. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.